All right, hello, good afternoon, everyone. Going to kick off officially in just a moment. Wait for people to log on. While you're logging on, let me just quickly note the date, the time, where you are, and who you'll be hearing from today. So today's date is September 29th, 2022. You're joining the National Center for Medical Legal Partnership at the George Washington University for the kickoff webinar for our very first Health Center MLP environmental scan. So thank you all for joining us. I'm Bethany Hamilton, co-director of the National Center for Medical Legal Partnership. And I'm very happy to be joined today by my two colleagues here at the National Center, whom you'll hear from more than you've probably heard from before, because they're usually working behind the scenes, and I'll introduce them in just a moment, but you're going to primarily hear from them on what we plan to do in order to collect and harness and leverage the power of the data. So welcome. So we're just giving folks a couple of seconds more, wait about 30 more seconds for folks to join and log in, because we're right at 1 p.m. Eastern time on September 29th. Okay, so as folks continue to join us, let me just reset the room again and welcome everyone. Again, today is September 29th, 2022. Welcome to the National Center for Medical Legal Partnerships Health Center MLP Environmental Scan Kickoff webinar. I'm Bethany Hamilton, co-director of the National Center for Medical Legal Partnership. As you join us here today, please let us know who you are. It's really good to know who's actually joining us in the live attendee audience. So if you're from a health center, let us know. If you are from a different type of health system, we know that you often take time out of your schedule to really join us on these HRSA-funded webinars, and you are welcome to continue to join us on today's webinar, but let us know who you are and where you're from as well. If you are from the legal services arm of the medical legal partnerships, please let us know who you are and where you're from. Are you from legal aid? Are you from a law school? Are you from the private bar? And perhaps you are a funder or supporter or stakeholder, or provide pro bono support to your local medical legal partnership run by a health center. Let us know who you are and who's joining us today. And if you're from something else, perhaps you're from an agency, let us know who you are as well, and welcome. All right, so rolling right into our content, I do want to acknowledge and thank HRSA for allowing us to utilize a separate award that we received as a National Training and Technical Assistance Partner. It's through the American Rescue Plan to really find out exactly what we thought had been going on for the last 2 years, which is Health Center MLP growth. So this is a HRSA-funded webinar supported by American Rescue Plan dollars. A little bit of housekeeping. You are joining us on Zoom webinar. We have enabled both the chat as well as the Q&A. We are asking if you could please primarily utilize the Q&A function to submit your questions to us today. That's where we pay most attention, but we'll also be in the chat, especially to recognize those of you who have joined us and see if any questions happen to make their way into there. You are on mute. But again, you can engage your Q&A in chat. Also, if you do need additional access, please feel free to activate captions by selecting live transcript and showing subtitle. If you need any assistance, send a quick email to ncmlp@gw.edu, or if you want to reach us right here online, just send a chat and we'll look out for it. And you'll send that chat to either me, Danielle, or Catherine on the NCMLP team. To answer the question that we know you always have, yes, this webinar absolutely will be recorded, because we're going to be providing some instructions as well as some data and information that we want to make sure you utilize as a resource as you engage and help to spread the word to get others to engage in this very important version and iteration of our annual MLP survey. All right, so as mentioned, I am Bethany Hamilton, co-director of the National Center for Medical Legal Partnership. I'm also very happy to be joined finally for one of our live presentations, and you'll definitely be hearing more from them than you usually do. First, Danielle Rahajison, our project lead on the team, and Catherine Stinton, our communications associate. Unfortunately, today, our student, who's a data science master's student, isn't feeling so well, but that's Reha Mani Kandasamy. She's our research assistant on the team. She's unable to join and apologize. I hate to have to also apologize again, but I want to ask you all to please send your thoughts, positive, super positive thoughts, to our invited, ready to go special guest speaker, Keegan Warren Clem, who is unfortunately unable to join us today. But as she is that diehard MLPer, actually offered to even record some remarks. So please send some thoughts, positive wishes to Keegan and her family right now as she's attending to a medical emergency. Keegan, we're thinking about you. Thank you so much for your support on this Health Center MLP environmental scan and continue to champion and push for MLP advancement and growth in your new position as a senior consultant at HMA. You all will hear from Keegan at a later date on another live webinar that we have for the Health Center MLP Toolkit. And when we actually post these slides, we'll actually seek her permission to post the slides that she had prepared for her keynote remarks. I will not be able to do justice, I think, to her hyping up of the field for completing another survey, if you will. But I will do my best on behalf of the National Center and the Health Center family and the legal aid world from which I also come. And so let me do my very best to get you excited about really filling out another document that asks you to tell us about what great work you've been doing in the field between health centers and legal aid providers to address those mounting needs of the communities that you've been serving. We know that in 2014, HRSA made policy changes, right, to the Section 330 Enabling Services body of work to allow for an explicit mention that enabling services includes screenings and referrals to civil legal services. Upon that change is when we really saw immediate ramp up and growth in the Health Center MLP movement. And it made sense, right? There is now this defined bucket and area of policy that could be relied upon by health centers to be able to say, yes, we actually can do these partnerships, and here's a stamp of approval by HRSA. But also it was tied to a body or source of funding, some of which they could tap into to be able to provide that support to civil legal services to better address those health harming legal needs of the patient populations that they serve. What you'll hear Danielle Rahajison on our team present today is what we've seen in terms of the results and outcomes of that work over the years. I can give you a heads up that bullet point number 3 on the screen, that's already outdated. So Danielle will tell you what we currently have in our database in terms of the number of health center based MLPs that we know of. And that is, we know, not reflective of the actual number of health center MLPs operating right now. Hence the importance of this particular environmental scan. We also know and have heard numerous times, again and again and again over the last 2 years, that the data is what was laid on bare by the pandemic, that data that showed the inequities, the gross inequities and disparities among the populations that we serve when it came to the impact of the pandemic and the economic fallout. That included the eviction crisis and who was affected most. That also included what we see now, which is slipping into a recession and who's affected most. Every policy decision, Supreme Court decision, right? Who is affected most? It's the data that tells the story. We absolutely need the data from you. We know and thank you all for completing the many surveys you've all been completing over the years. This is very different. We held off at the National Center from conducting a survey throughout 2020, 2021, and the beginning of 2022 because we knew and we had seen what data you had already been pouring in to be able to advance your work. It is time for us to show not just HRSA or LSC or others what you've been doing, but show that broader field of stakeholders, the policymakers, the health plans, the very people that you serve, those patient populations who are also advocates on behalf of MLPs, it's time for us to show what you've been doing. So please, 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 I am asking you to please support. It's not just the National Center on this environmental scan. This is ultimately supporting yourselves by letting us know what great work you've been getting done. And then in that very same instrument, letting us know what we can do to create better resources, improve our technical assistance and trainings, and also take the right message to the right folks at the right time and build up networks of health center-based MLPs along with your champions in other spaces in healthcare to advance your work and actually see broad population health outcomes, improvements in health equity, and the full realization of what we can get done by building medical legal partnerships in every single one of our 1,400 health centers around the country. Let's get it done. There are 30 million patients being served by health centers annually. That's the current count, and that too is growing. And unfortunately, we know, based on LLC's Justice Gap report, that what we thought would occur during the pandemic, we have a growing justice gap. Let us help you get it done even better. I'm going to pass the mic on to my colleague Danielle Rahajason to dive a little bit deeper into what we've been seeing in terms of the data, and hopefully you can help us to leverage further data about what you've been doing through the environmental scan. Danielle, I'm going to pass it on to you and let me know when to advance your slides. Thank you all for joining us.
Thank you so much, Bethany. So why now? Bethany, I think, did an awesome job discussing that with us, so I'm not going to rehash what was said. However, I do want to emphasize that we do know that health centers have an important and essential role in addressing the health harming social and legal needs of their patients. So by integrating standardized screening for social determinants of health in their care delivery models, health centers have become an essential partner to the civil legal services community with shared goals of health equity and justice. So as such, it has become crucially important to understand the different strategies and partnerships that have emerged from this crisis. Next slide, please. So after almost 2.5 years of adjusting services and operations to meet the evolving needs of low-income populations during the ongoing public health emergency, it's important to look at the data that emerged from that and understand the current and emerging social needs for health center patient populations. You've already probably heard about us talking about this during one of the webinars disseminating our MLP in health centers toolkit last week. But in 2021, the Kaiser Family Foundation and the Geiger Gibson Community Health Foundation Research Collaborative at the George Washington University surveyed health centers to better understand how the pandemic has affected health center patients and services, as well as the challenges that they and their patients face. This survey found that health centers have seen a rise in patients seeking non-medical services and services related to housing, food, nutrition, transportation services are one of the most that saw the most rise in demand as a result of the pandemic, All of these issues may also have legal underpinnings associated with them as well. We know that over half of the health centers that were surveyed responded that more patients are seeking social and supportive services to complement primary care, and about 33%, we know that there was an increase of about 33% of patients seeking legal services specifically. We also know that health centers have always adapted to the growing community needs. For instance, since the public health emergency, health centers have expanded mental health services, provided medication-assisted treatment for opioid use disorder, and many more non-medical services as well. So from the past NCMLP, MLP services of the field, we know that health centers use enabling services funds to support MLP services for their patients. About 38% of health centers indicated that they use some enabling services funding to support MLP services for their patients. And as Bethany mentioned, this is one of the data points that we are hoping to assess with this scan as well. Also in 2021, the National Association of Community Health Centers, or NAC, through its training and technical needs assessment survey, reported that health center leadership identified enabling services as an emerging issue or trend, and expressed the need for increasing reimbursements for enabling and social services as well. So on the next slide, we just, what does a typical health center with an MLP look like? So this was taken from an issue brief that takes a closer look at operations and financing for health center-based MLPs, and we can share the link to this in the chat, but this is also on NCMLP's website. So we know that on average, health centers with MLPs serve 45% more patients and complete about 54% more patient visits annually across 3 to 4 more healthcare sites compared to health centers without MLPs. Health centers with MLPs employ approximately 1.8 FTE, additional medical staff per 10,000 patients, and 2.4 FTE of enabling services staff per 10,000 patients compared to health centers without MLPs. Health centers and MLPs typically have larger budgets. The average revenues, whether that be from state or local funds, foundations, contracts for health centers with MLPs, were more than double the revenues for health centers without MLPs. So health centers with MLPs may be more willing and able to support the integration of social determinants intervention into clinical operations. We also know that MLPs tend to be found in large urban cities. This is because rural areas have less access to both traditional civil legal aid and healthcare services, and it can be harder population to reach. So while there is significant unmet demand for legal services in those areas, individuals are usually more spread out. So connecting individuals with legal aid can be challenging in rural areas. And then finally, health centers with MLPs typically utilize health IT to coordinate or provide enabling services more often than health centers without MLP. Next slide, please. So who are these MLPs, specifically health center MLPs? Historically, MLPs grew out of children's hospitals and were focused on pediatric populations. MLPs have since spread to other organizations serving a variety of patient populations, general hospitals, health systems, health centers, veterans health systems, private and nonprofit community clinics, and others. Specialty healthcare providers now include MLP services in their operations. As of September 2022, there are about 487 MLPs in 49 states and DC, with many more in the planning phase. So this wheel represents all MLPs representing all organization types that have been registered in our database as of September of this year. There are limitations to this data. We do not require MLPs to report to us, and we gather data information from new MLPs via 3 main avenues, which are the yearly surveys, direct outreach from and with MLP contacts, and also from news alerts about MLP programs. This means that there are MLPs in the planning phase or established MLPs that have not made it yet to our database or that we may not be aware of. With those data limitations in mind, our database indicates that there are about 202 health center and lookalikes combined, which represent about 45% of all MLPs nationwide. Federally qualified health centers specifically represent about 1/3 of all MLPs with a count of 162. So health centers represent the fastest growing sector for MLP adoption across the healthcare landscape. Health centers have intimate knowledge of the communities that they serve and provide care to the most vulnerable and underserved populations by design, making them a natural hub for MLP activity. So on our next slide, in terms of growth of MLPs and health centers, represented by the graph here, health center count with active MLPs has almost tripled since 2015. There was a significant increase in health center MLP count from 2017 and 2018. The MLP Health Center movement was rapidly growing, and in late 2016, NCMLP conducted a national, very robust survey on MLP trends and activities. This allowed us to not only update our MLP count, but also better understand the MLP landscape. And again, this is also what we hope to achieve with this scan. Following the 2016 national survey, we started conducting a less robust yearly survey, which allowed us to gather important information on health center MLPs and also update count. This also partially explains the important increase that we see from 2018 and 2019. But the yearly surveys really are a big part of what allows us to better understand the TTA needs of health center MLPs. They inform trainings and technical assistance, which in turn helps health centers establish MLPs, helps them with training staff, and so forth. For instance, these surveys have empowered us to develop a health center toolkit for building and sustaining a health center MLP, which was an important resource that helped expand our reach in health centers. So the yearly survey was paused during the public health emergency. So we were not able to update the MLP count during that time. This does not mean, of course, that no new MLPs were established, only that the main source for count updates was paused. So as I mentioned before, the database indicates that there are about 162 health center MLPs as of September. However, we know of at least 10 new health center MLPs that are in development and more in planning from our TTA with the field, which explains that 175 number that you see under 2022. So we suspect that there was about a 10% growth from 2020 to 2022. Although there has been a growth in health center MLPs, 175 health center MLPs represent about 12% of all 1,400 health centers nationwide. And our mission at NCMLP is to have an MLP in all health centers and lookalikes as well. Next slide, please. So what you see here is a map of FQHC, a federally qualified health centers, MLP only. It's a visual just to help us understand where they are and operate. You will be able to see the map and number of health center MLPs in each state at the end of this deck when we distribute it to you. It's a little bit small here, so at the end of the deck, it's bigger, so you can really take a look. Health centers operate MLPs in about 39 states, including DC. In 2019, it was 33 states, so they were added in states including West Virginia, Utah, Wyoming, amongst others. The top states with health center-based MLPs include California, Illinois, New York, Florida, amongst others. And on the next slide, please. So part of the flexibility of the MLP intervention is in its ability to be tailored to the health center's desired population. The majority of health centers with MLP report that they provide MLP services broadly to a general low-income patient population. However, some MLPs target specific populations such as children, the elderly, immigrants, as well as high needs group, such as individuals experiencing homelessness or individuals with chronic conditions such as diabetes. In these targeted MLPs, the legal services offered may be tailored to meet these needs of these specific health center patient populations. So in addition to the general population, populations most served by health center MLPs are represented in this graph. So for instance, our database indicates that 29 health center MLPs serve those who are homeless or unstably housed, which represents about 17% of all health center MLPs. So I know that I threw a lot of data at you in the span of about 10 to 15 minutes. So I want to remind you, everyone, that this deck will be shared with you. And if you have specific questions, we are happy to answer them. And if they are really specific, I invite you to please email us with your questions through ncmlp@gwu.edu.
Thank you so much, Danielle. That was excellent. We actually do have a couple of questions. So let me start from the second one actually that came in, is there a way to query the NCMLP database? I know all of us on the team often get emails asking about health center numbers or locations of health centers. So Danielle, can we get you to take a stab or explain how to query our existing database, and then I can follow up on that response to share what we hope to make of the data coming in from this environmental scan.
Yeah, so if you have a very specific question, you can always send them over, such as, is it possible to know the names and contacts of MLPs who are in California, for instance? You can always email us at ncmlp@gw.edu. At the moment, we do not have a place where we have all of that information available to the public, but again, with this scan, we're looking into all of the avenues that we may be able to do something like that. I don't know if you have anything to add.
Yeah, just a little bit. I just want to remind folks that this particular environmental scan is funded by HRSA. A lot of it is asking for data that is being collected by you and reported in databases such as the UDS, if you're a health center, and reporting on enabling services, funding being utilized for legal services. For those who might be LSC funded, perhaps you are reporting some of your data, some information that we're going to be asking you about in this environmental scan. So how are we going to, I think, incentivize you to fill out yet another survey or bring that data into our environmental scans survey instrument? This time around for this version or iteration of our focused survey, what we do plan to do is we're going to validate that data, or do our very best to do that, analyze what it's telling us in terms of the locations, the penetration, the type of services that those MLPs are providing, and we're going to kick out a fact sheet. And then you'll join us again in the spring once we're able to get that work done, and provide our findings webinar. And then we're hoping you can actually utilize that first of what we hope will be a continuing working fact sheet, right, to highlight the data. We're actually hoping you can utilize that in funding conversations, policy conversations, just conversations with your communities about how your MLP is getting its work done and how it can be better supported. Right now on our website, we will hopefully be able to use some of this data to update the map. And if you saw our newsletter go out today, you saw that we just co-published with Georgetown University, Health Justice Alliance, what they pulled together last year, which is an academic MLP survey and brief. So take a look at that report, because hopefully that's going to be the roadmap going forward for how we incentivize and allow you to utilize all of that data that you've given to us, and we've aggregated, analyzed, and pushed back out in ways that are far more easy to digest than large Excel data sets or maps without, like what's on our website right now, maps without any true information about what's going on in that particular state. So hopefully that's helpful to the person who asked and posed the question, because we too want to know more and be able to share more with folks who are interested in supporting you. Danielle, there's another question in here. What's the definition of a health center for the purposes and within the scope of our environmental scan? Are we only asking for those FQHCs, the funded ones? If you want me to clarify, I can, but I'm pointing to you.
Yes, you can go ahead and clarify.
Okay, so folks, you'll notice that and Danielle, what I'll do is I'll just slide back to the slide you presented here. For the purposes of our environmental scan, we do want to make sure we are counting not just the HRSA funded health centers, the migrant health centers, FQHCs, the healthcare for the homeless programs, right? We want to make sure we're also counting those lookalike programs, the ones that aren't yet receiving those Section 330 grants, but for all intents and purposes are operating just like the FQHCs, carrying out the enabling services work, partnering with the legal services providers in their communities, and we want to be able to count them as we always have done so in the past. So for the purposes of our environmental scan, we are including both HRSA funded and non-HRSA funded or lookalike programs. However, if this question is also about, well, what about the rest of us doing MLP work, the children's hospitals, right? What Danielle highlighted, those who are in general hospital systems or the VA medical systems, we do have live right now, and we'll continue to share and utilize a general, much briefer questionnaire so that you can keep us updated on all of that other awesome MLP work that you are continuing to get done. But I just want to go back to what I mentioned, there's an academic MLP report that we just pushed out. This one is focused on health center MLPs, and we're hoping to, I think, create a roadmap for more focused deep dive analyses on what the field is getting done. So please, those of you who are not in the HRSA or health center funded or lookalike space, please utilize that additional link that is currently on our website and we'll continue to push out in our newsletter so that you can give us the updates about what your MLPs are getting done. Hopefully that answered the question as well about what is the definition of health center, only FQHCs, because I assume that's really about, within the scope of our environmental scan, who are we defining and asking to provide us feedback through the environmental scan for. Okay, let me click done on the Q&A. And we have another question. Danielle, I'm going to see if we can tackle this one. So Margaret's asking, is there any guess how many informal MLPs are operating before we tackle that? Margaret, we might need your help getting a little bit more information. Danielle explained that and Danielle, I'm going to use one of your other slides, this slide, that we do know about an additional 10 or so, probably more even now, MLPs that are developing, but I'm not sure if that's what you mean by informal MLP. So if you could help us define what you mean by informal, feel free to use the chat, Margaret. We can, I think, better answer the question. Danielle, I'm not sure if you want to take a stab at that.
No, that's right. And in addition to that, what I can say is that for now, we only count MLPs who have a formal agreement between the legal and the health partner. So if there is no formal agreement at the moment, we do not count them as MLPs.
Right, for the map, but we're definitely collecting, we're asking in the environmental scan instrument if in fact you do have an MLP. That helps us to track exactly what Danielle noted, is knowing the difference between whether how you're operating, whether you're still in formation, is there something you're doing, is there like that is on perhaps like a handshake type of agreement until you get a new MOU perhaps in place. So still fill out the scan, and there is a question that is built into, and there are two instruments. We're still running it, this big one, using two instruments, one for the healthcare partners, one for the legal partners. But there is a question that specifically asks if your program has an MOU in place. Thanks for tackling that, Danielle. And hopefully, Margaret, we actually answered the question that we think we were asking. But please send us a note in the chat if we didn't get to what you were trying to learn more about. Also, folks, you'll see in the chat that Catherine Stinton has shared several resources that we want to make sure you continue to utilize. The Health Center MLP Toolkit has been shared. The new academic MLP report has been shared. I just want to note that the Georgetown team and the researchers reached out to folks around the country, and they were able to build upon the 8 core components of traditional MLPs to highlight some unique core components for academic MLP. So I'd encourage you all to utilize that report and reach out if you need to contact the Georgetown team for any assistance, understanding how to utilize it or what those additional core components are, as they found at different academic or AMLPs. What you'll also see, and this is just before we pivot into Catherine's portion of the presentation, you'll also see a link to the form that you can utilize if you are not a health center, because we definitely want to make sure you are in our database and on the map. I will just utilize last year as an example of why it's so important to keep us updated with information on your medical legal partnerships. There were some major policy opportunities that came up last year to help advance medical legal partnerships. Also at the administrative level, there were several agencies that were interested in what they could do to support you, but also highlighting the role that MLPs play with respect to addressing the needs of various populations. And so it is extremely important for us to know who you are so that we can build that network and use and uplift your voices to better inform what those stakeholders and supporters would like to get done on your behalf. So please, even if you're not a health center, we are all, and we'll be filling out the environmental scan. Please take a moment to copy and paste and bookmark that link to what will always remain live. And that's the general form that we utilize to get updates at any time for any type of medical legal partnership. Okay, let me see if I can answer before we move on to Catherine. There's a question in the chat from Bonnie. How are rural areas assisted in accessing MLP, special funding, virtual legal services? Bonnie, those are exactly the types of questions that we are asking in the environmental scan. So that's why we're going beyond the short form for updates to find out who is out there doing an MLP and targeting specifically health centers first in this particular focused MLP survey funded by HRSA dollars to find out more about what that reach looks like, what the modalities are, and have people continue to do what we saw, I think, advance very quickly, thanks to the telehealth advancements at the beginning of the pandemic, which was virtual legal services. But we also know there are limitations due to digital divides, due to cost barriers related to that virtual access. So we are, in fact, Bonnie, trying to answer the very questions that you posed in the chat in the most accurate way possible. So please, Bonnie, spread the word about the environmental scan so we can help get answers to exactly those questions you pose and more. And thanks for posing that question, Bonnie. All right, if there are no further questions for now, but please, please, please share them. We'll keep track of them. I'm going to now turn it over to my other colleague, Catherine Stinton, so that she can tell you about the mechanics of this year's health center, or first year's health center MLP environmental scan. Catherine, I'm going to move the chat out of my way on my Zoom screen, go on mute and pass it on to you.
Thank you, Bethany, and thank you, Danielle, for all of that data. If we could go ahead to the next slide, please. I'm not going to rehash this too much because we've covered it a couple of times now, but we have performed periodic scans in the past, specifically to monitor the development of new medical legal partnerships, to build a network of practitioners and of other experts like our researchers, and then to develop better resources such as that toolkit that Danielle mentioned earlier, the map, and then our other webinars and learning collaboratives. Next slide, please. Specifically this year, again, we are focusing on those health center-based MLPs in addition to the link in the chat, however, and the QR code, there's a QR code here for those of you who are not part of health center-based MLPs. Like Bethany said, we do still want to keep informed of what's going on in your world. So definitely follow that link, fill out that form, and let us know. We are doing separate instruments for our legal and health providers on the health center-based form. We know that our legal providers may have insights that our healthcare providers are less able to provide and vice versa. So we wanted to make sure that it was easiest for whomever was actually taking the time to fill it out there. It was also mentioned that we will be reaching out directly to the contacts that we have in our database. The PCAs, HCCNs, and then for those legal teams, we're also potentially going to reach out to NLADA. And then finally, of course, once it's all analyzed and verified, we will create that fact sheet and webinar come spring. If we could go to the next slide, please. So of course, we're here today with our kickoff webinar. The instruments will be open and posted probably about this afternoon. From here through October 31st, you can start, stop, collaborate with other people to fill out this form, but we do ask that they are completed by October 31st, at which point we will close down those links. from October 31st through the winter is when that data validation and analysis will take place. It may involve us reaching out to some of you just to clarify some of the information, make sure we've got it totally correct. And then spring 2023, of course, again, is that webinar and the fact sheet. Next slide, please. So if for some reason we're unable to capture you via our direct outreach, we are also going to host this on our website. As you can see on the graphic here, it has a home in our menu, and it will be updated to have a section specifically for, on that main page, specifically for the healthcare partners forum and then the legal partners forum. And just for future reference as well, once the recording of this event is processed, prepared, and everything, it will also be posted to that left menu there. Next slide, please. So to actually complete the scan, we tried to make it as easy as possible for you to fill out yet another form for us. It is hosted through SurveyMonkey. You'll see yes, no questions. You'll see open-ended answers, things like that. And we did want to make sure that you were able to start and stop because we know that you've got a lot on your plates and may need to walk away. But there are two caveats to that. The first is that your responses are saved after you hit next. So essentially you need to finish a page's worth of questions, hit next, and then it will be saved for you. The second caveat is that if you start it on your personal, your office computer, it has to be completed on that same computer. Unfortunately, you can't tap it between like your phone, your personal computer, or your colleague's computer. It must be that same device. And then of course, finally, once all is done, you can go back with the previous buttons to see, double check your work, make sure it's good. But once you're finished all of that, just hit done and it'll send it over to us. And that will be the heavy lift for you there. And that is actually as simple as it is. So I think if you want to hit next, we are ready to open up for questions.
Yep. Thanks, Catherine. I just put a quick note in the chat. Given the tech, of course, we know, let me just call it inconveniences, right, related to various survey instruments, that it might be helpful to have a hard copy so you can just see the whole thing all at once. So we'll be sure to share PDF copies of each instrument, each questionnaire form, so that you can really zoom out, figure out like globally, what are all the questions that are being asked? Who are the folks on my MLP team or on my health center staff or on the legal services partners staffing that can fill out these questions, and then go into the actual SurveyMonkey to fill it all out. So we'll be sure to share those as PDFs as we have years ago when conducting similar surveys to make life a little bit easier for you all as you complete this, and also as you help us spread the word. So Bonnie is asking a question. Assume only one of us, clinical or legal, in the MLP completes the survey. There are two different instruments, Bonnie. Catherine, you want to take a stab at that, or do you want me to help to clarify?
Why don't you go ahead and take that one?
Sure. And then Danielle has the longer history than both Catherine and I on the MLP survey. So as we've done in the past, Bonnie, for the larger two-part MLP surveys, you will probably want to ensure that you've identified for the healthcare instrument, the healthcare partners lead or the individual who would be able to fill out most of those questions. That's going to be a separate instrument with its own unique individual link. For the legal side, same thing. You're going to identify the individual who can answer those questions and share that legal partners link. On the back end, we'll be doing the work to do the matchup in data. We have our team, including Ray, who couldn't join us today, a data science student who's actually already done a crosswalk of the very long list from the UDS of every single health center entity. And she crosswalked it with, she created a program to crosswalk that with our existing MLP database. And so we'll do some work on the back end to ensure that in case there are entries like the names of organizations that look a little bit different, we'll do some of that data validation by reaching out to you. So two separate instruments, one for the healthcare folks, one for the legal partners. And it's up to you to identify who are the folks who can take on answering those questions, which is why the PDF hard copies of the instruments is also particularly helpful. Thanks for asking that question, Bonnie. I'm going to go to the Q&A next. Catherine, there are 2 questions in the Q&A. First one, when was the last time this environmental scan was done for non-health center-based MLPs? Danielle, do you want us to kick that one to you? Or, sorry, Catherine, go ahead.
I was going to say, I know the last full, very, very in-depth scan was, I think, 2016, but there have been smaller periodic ones. And I believe, I'm not sure the exact last date on that one. If Danielle, you could pop in here.
Yeah, the last one that we conducted, a less robust yearly survey, was in 2019. Yes, and that's of all MLPs, not just FQHCs and lookalikes.
Right. And then under our Bob Woodruff grant to work with and create resources for VA MLPs, there was work done there to get updated counts on the number of VA MLPs, showing the growth to, I think, at or about 33 when we last looked at this, right at or around the end of 2020 or maybe beginning of 2021. So to what Catherine and Danielle's points are, even on the academic MLP, right? For NCMLP, the last big all-inclusive comprehensive one of all types of MLPs, 2019, hit pause, but other focused reports came out. And we've still been tracking. We have everything from Google alerts to our inboxes where people have shared updates with us to try to keep track on update and increase those numbers. And so hopefully our public versions of our numbers on the maps will soon get updated. That is definitely forthcoming. Thank you to the individual who asked that question. There's another question in the Q&A, Catherine and Danielle, regarding the save. Catherine, I think this one's for you because I definitely cannot answer this one. And I think you mentioned some of this. Regarding the save and continue function on SurveyMonkey, does it need to be continued on the same computer or from the same IP address?
Unfortunately, I believe it has to be that same exact device. So we can't switch between that specific computer. Bethany did mention that we are going to try to create those PDF forms so you can prepare your work in advance and work on it offline until you're ready to pop it in. But unfortunately, for the online portion, it is a single computer.
Mm-hmm. Thanks, Catherine. And thank you to the individual who asked that techie question. Consider me a Luddite. And I couldn't take a stab at that one, even if I tried. All right. Any other questions about our health center, our very first focused health center MLP environmental scan, thanks to funding from the American Rescue Plan, and our work with HRSA as a national training and technical assistance partner, we are able to finally get this done. And we are going to use it to, I think, really build on this roadmap that is being created for more focused MLP survey instruments or scans, and then reports or fact sheets that really highlight the work that those particular types of MLPs are getting done. If there are no more questions, let me first thank Danielle and Catherine for really working very hard while we're also preparing for another 3-year competitive grant cycle to prepare the scan. Reha also has been in SurveyMonkey helping to update and build a scan, and also thank Keegan, Warren, Clem, who prepared her presentation and slide deck for today, but unfortunately couldn't join us. And offered to even do a recording. She does not have to do that, but please, you all send her well wishes right now to her and her family, as well as Reha, who's not feeling well today. We're asking you all to please help us share with your MLP state-based coalitions, your PCAs, your HCCNs, and other networks, the folks who can reach out to en masse their legal partners, as well as their healthcare partners in mass. Please help us share the Health Center MLP environmental scan. If you happen to join us and you're not from a health center, we know that many of you partner with or collaborate in your communities with those health centers and lookalikes. And so we please ask you to share it with them as well. And look forward to the fact sheet once we bring in all the data, where we'll highlight some of the findings. and then our webinar in the spring to help you learn more about what's being highlighted. By the way, as a heads up, that environmental scan has questions about the impact. Please share with us what you've been doing in the patients of policy work, what you've been doing to churn out research and evidence to support your work and the data, the evidence, the science behind your work. That will also be utilized by our communications associate, Catherine, to churn out those stories that we've really been dying to get out there in the field. Finally, let me just get to the contact slide here to make sure everyone knows if you do have questions, please email us. The entire team can be emailed. We check this inbox. It's ncmlp@gwu.edu, or you can visit the bit.ly link, bit.ly/MLP scan for more information. It's on our website. You saw that Catherine showed you we have a dedicated navigation bar menu specifically for it, but reach out to us anytime at that general organizational email inbox if you have questions. You'll see some highlights from what Danielle shared, as well as that map for the FQHC MLPs when the slide deck comes out in the appendix. Again, we have that the former report that I think folks were asking about, like, where did this all start, right? It's a 2016 report. We'll include a link to it in the slide deck, and the brand new one that the Georgetown University Health Justice Alliance team pulled together, and that just got published this week and pushed out in this morning's newsletter. Use it, spread the word, help us pull out some more data specific about health centers, and then everyone else will look forward to receiving your updates on your medical legal partnership work. Everyone, thank you so much for joining us. There's a link also to an attendee survey, and let us know if you need any additional assistance. Thanks for joining us today, everyone. Take care.